Hi, good morning, Cameroon. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your role play.
Good afternoon. Please come in and have a seat. I'm Nurse Cameroon Spring, and I'm here to help you. Could you tell me your name, please?
Thank you. My name is Mihiraa. I'm 45, and I feel my drinking is affecting my health. I get tired easily, and sometimes I feel shaky in the mornings. I want to reduce or stop, but I don't know where to start.
Thank you, Mihiraa. I'm really glad you're here, and I hear that you're feeling worried about your health and daily functioning. We'll go step by step. So first, can you tell me some more relevant details for my understanding?
Sure. I've been drinking almost every evening for years. Recently, I feel my memory is not as sharp, and I had a scare when my liver function test came back slightly high during a routine checkup. My doctor didn't say it was serious yet, but I don't want it to become serious. Also, I feel I'm not as focused at work.
I see, and I appreciate you sharing that. So the main reason for your visit is concern about your health and daily functioning, especially after those liver test results and feeling less focused. Now, to help you better, let me ask a few more details about your health. Do you have any underlying health conditions like diabetes, high blood pressure, or any liver problems that you already know about?
I have mild high blood pressure, but I take medicine for it. No diabetes. I've never been told I have liver disease, but the recent test worried me.
Thank you. And how many years have you been drinking regularly?
Probably about 20 years, since my mid-20s. It started socially, then became daily.
Can you tell me, on a typical day, how many units of alcohol do you drink?
I drink about half a bottle of wine every evening, sometimes more on weekends. That's maybe 5 to 6 units a day.
And have you ever tried to stop or cut down before?
I tried stopping once last year on my own, but I felt very anxious and couldn't sleep, so I started again after 3 days.
Thank you for sharing, Mihiraa. I want to speak with you honestly but gently about what continued alcohol misuse can mean for your health, because you deserve to know the truth so you can make the best choice for yourself. Over time, drinking at the level you described can lead to liver cirrhosis, which is when the liver becomes so scarred that it cannot heal itself, and that is a very serious condition. It can also cause damage to your heart, making your blood pressure harder to control and increasing your risk of heart problems, and damage to your brain, which affects your memory, concentration, and mood. Your mental health can also suffer because alcohol often worsens anxiety and depression over time, even if it feels like it helps in the moment. These are real risks, but the good news is that reducing or stopping now can prevent them or even reverse early damage. Now, you do not have to do this alone. There is help available, such as community alcohol teams who can support you in your own home, counseling to understand why you drink and learn new coping skills, and a GP-led detox where a doctor gives you medication to stop safely. Given what you told me about feeling anxious and unable to sleep last time you tried to stop, I would strongly recommend medical support. So I would like to know, what concerns you most about giving up alcohol?
I'm afraid of withdrawal, the anxiety and insomnia I felt before. Also, my friends all drink, and I don't know how to say no. And honestly, drinking helps me relax after a stressful day.
Mihiraa, I understand that drinking has been your way to relax after a stressful day. So let me gently suggest some alternative relaxation methods that can give you that same sense of calm without harming your health. For example, gentle exercise like walking or swimming releases natural chemicals in your brain that lift your mood and reduce tension. Breathing techniques, where you slowly breathe in for 4 seconds, hold for 4, and breathe out for 4, can calm your racing heart within minutes. You might also discover new hobbies like gardening, painting, or simply listening to music you love. These activities can shift your focus and bring you genuine peace. Now, to help you avoid falling back into habitual drinking, I recommend first removing all alcohol from your home so it is not within easy reach. Next, try to identify your triggers, such as walking past a pub after work or sitting in your favorite chair at your usual drinking time, and then consciously avoid those situations. Instead, engage in other activities at that same time, like calling a friend, preparing a healthy meal, or stepping outside for fresh air. These small changes can slowly build new, healthier routines for you.
That sounds possible, but I'm still worried about withdrawal symptoms.
And you are right to be cautious. Withdrawal symptoms can include anxiety, insomnia, sweating, racing heart, and in some cases, nausea or shaking. These can start within a few hours of your last drink. Because you had symptoms before when you tried to stop, I strongly advise you not to stop suddenly on your own. Instead, seek help from your GP or an alcohol clinic where they can monitor you and possibly give medication to make withdrawal safer and more comfortable. Never hesitate to call for help if symptoms become severe.
That makes me feel safer. But still, I'm not so confident enough.
Mihiraa, I hear you, and it is completely normal to feel lacking in confidence right now. Change is hard, and you have been very honest about that. So let me remind you of the beautiful benefits that are waiting for you on the other side. When you stop or reduce your alcohol intake, you will notice a healthier lifestyle almost immediately, better sleep, more energy in the mornings, and less of that shaky feeling you told me about. Your mood will improve because alcohol is a depressant, and many people feel calmer and more hopeful within just a few weeks. There is also a very important long-term benefit. Your risk of cancers, especially liver, breast, and mouth cancer, goes down significantly the longer you stay away from alcohol. And perhaps most meaningful of all, your relationships with family and friends often become stronger because you are more present, patient, and reliable. You do not have to do this alone or feel confident all at once. That is why I want to offer you something practical. Let me book you an appointment at our alcohol specialist clinic, where a team will do a full assessment of your physical and emotional needs and then provide ongoing support, including medical help for withdrawal if needed. Taking this first step with professional help will build your confidence slowly but surely. Would you like me to arrange that for you today?
Yes, please. I think I need that.
I'm very proud of you for taking this step, Mihiraa. Let me quickly summarize what we discussed today. You came because you are worried about your liver and feeling shaky and unfocused. You have been drinking about half a bottle of wine daily for 20 years with mild high blood pressure. You tried to stop once and had withdrawal. We talked about risks like liver cirrhosis, heart and brain damage, and mental health issues. We discussed help from community teams, counseling, and GP-led detox. Your concerns are withdrawal, social pressure, and losing a coping method. I recommended exercise, breathing, hobbies, removing alcohol from home, and avoiding triggers. I warned you about withdrawal symptoms like anxiety, insomnia, and racing heart, and advised you to seek medical help. I stressed benefits like better mood, lower cancer risk, and better relationships. I will now book you that appointment at the alcohol specialist clinic. Does that sound clear to you?
Yes, very clear. Thank you so much.
You are most welcome. I'll arrange the appointment now, and we will support you every step of the way.